Hello, country people. I salute una na me, Dr. WAN, na una pikin, na una brother, na una moyo, una doctor. I don't come again for throwaway tori for people them where they get sugar for their blood. They call them for big book say diabetes. Like I be talk last time say me I go make some video them. I be done promise one and I'm here to maintain my promise about this story for diabetes or what they call them say sugar waiting for my skin. Now, I know say some people them they don't already start for the take some medicine where they call them say insulin. Insulin na medicine for diabetes type 1, not before type 2. I go tell una why. I know say people they go say, hey, Dr. WAN, it don't come again with another new story. But when I listen, fine. When you get for take that insulin, first of all, I want for make mommy they understand what to be insulin. Insulin na that thing with like injection where they chook them under your belly. So if they chook you anything under your belly before you sleep or whichever time of the day, then know that it is insulin. And that insulin, it is not meant for you to take it at home if you get diabetes type 2. They use that insulin only for two conditions. The first one is the one where you get pregnant. If the woman they pregnant, then insulin they fit use them. Another condition is the one where your sugar sugar inside blood over high. We say hyperglycemia. In that condition, they get for giving insulin not for hospital or for medical center, not be not for house. You not get for take them for house. I repeat again, do not for any reason take insulin at home. I know some people don't ask and say, but why Dr. WAN insist on this thing, say, make them not take insulin for house. Make they go now for hospital, go take them. First of all, make I explain a little bit what to be diabetes. So diabetes type 2 na condition where it come for your skin when you don't start to live better life because poor people they scarcely get diabetes. There are some few cases for poor people that they get diabetes. But if you look and fine. Man will get diabetes. Now man where your lifestyle don't change, it don't better. There's what we talk for big books say upgrade. Meaning say the time where mommy or papa will go work farm, wake up for 5 o'clock for morning time, waka kunya, go for farm, work for 10 hours, waka kunya, carry fire, you come back for house. That signal will be for his skin. But the time where one of the people don't go for America, someone go for Canada, someone go for China or Japan, they start sending mommy plenty money. Now for their way trouble don't start. So you see now, diabetes for most of the cases, it catch na man where it don't start to live better life. So now hear this story fine. If you dey inside poverty, you hardly get diabetes type 2. So that's why me I say diabetes type 2 na sick for rich people them. So mommy una here fine. Now, when your picking start sending you money from America or Canada or wherever, UK, your lifestyle don't change. You know to go walk that farm again where you will go before. Some mommy they even get lucky say they are picking them carry them go for wine man country like for Europe or Canada or US. So they stay them now for a house. They did look what grand picking them. Now for they way small, then too they tell them to say, hey, mommy, you get diabetes. So some man go say, hey, where is this thing coming from? Because your lifestyle it don't change. For Africa, you will go for bush, go work farm, spend the whole hours for bush, exercising yourself. But now for America or Canada or Europe, you just sit you for sofa and watch television the whole day. Even listen to some traditional music for clip or video. So your life now more sedentary. Sedentary life means you wake up for bed for morning time, you take heavy breakfast, you just sit down again, the whole day for house with grandpicking them. So the night come, you go again, go chop, go back for bed. That life na very bad life. We call them say sedentary lifestyle. Nothing will kill people them small. So if you be one of them, mommy them, where you live sedentary lifestyle, you know say diabetes a day for your door, it knock your door small. So here the story fine. When they don't diagnose that diabetes for you, the next story now say they go either ask you make you take metformin. Metformin na that medicine for diabetes where they give them for people them. Metformin is not been a bad thing, but insulin, that one where they give you injection under your belly, here this story fine, not been a fine thing. Mommy and papa them will not hear, even elderly or say younger them where they take that medicine, where they choke them for their belly, same sugar go down. Will not take them because sooner or later you pay the price. So that's my message. And the only way for cure or manage your diabetes na exercise. Not because she done for house like wash potato, not she done for that chair again. Once in a while, stand up, go around the house, do some little job, even take diagram, picking them for outside, una waka small. Now, so again for B. Not be enough she done for one place. Any morning you inject yourself with insulin. Say you want for bring down sugar. Now, big lie. We call it vicious circle. Vicious circle meaning that you inject the insulin and then the sugar goes down, but it turns out developing what we call insulin resistance. That's the whole thing here. For those who don't know, I want to make you understand this. So when you are on insulin, I'm sorry talking big grammar here. I want you to remember when I say, when you detect that insulin, you end up developing what we call resistance in the sense that you gain weight. For instance, you see some people that weigh, some women their chest a big sore. Now bad sign that when your chest start the big over, no say no fine thing. You there for big trouble sooner or later. So do not engage in taking insulin. If you need it, go to the hospital and use it there. And that should be for a short period. The ideal treatment for diabetes now for fine chop. And the fine chop here now, that one where you yourself, you cook them. Not go for market buying chop from gongong. Chop from gongong, it will kill you one day. It will give you heart attack. It will give you dementia. It will give you all sorts of stuff. So stay away from that chop them. Cook your own and take it there. And when you cook that chop, do not overcook it. For instance, jama, that one, try to chop them raw. Make even what we call smoothies. When you do smoothies, it will help you. So now my message that. Things like pear, you make sure you take it all. Avocado, get that one, some of it. And make sure you get something natural, not synthetic. Natural things helps you a lot. We want to put an end to this diabetes type 2 where you not be ever get them before. Remember, that 6 start only when you don't pass 25 years. So it means you don't do some bad thing them. That's why you have diabetes. Because when you born you not be get type 2 diabetes. So how come you have it now? That is a question you need to ask yourself time and again. But some time ago, I not be get diabetes. Now wait till don't bring this sick again, this sick from my skin. It means something don't go wrong. Either your lifestyle has changed, which is always the case. There's an upgrade in your lifestyle. So that's where the whole thing comes from. So that's the whole thing here. I go make another clip for explain Una very well now which kind of thing that we give for the taken for this diabetes story. That one will be a special one. I go design diabetes lunch, diabetes breakfast, and diabetes dinner. So the 3-course meal will be for my next clip. So mommy and papa, they wanna be prepared for listening to my next video. That video will contain 3 parts. Part 1 will be na breakfast. How breakfast for person will get diabetes type 2 a get for B. How lunch for someone will get diabetes type 2 a get for B. And how dinner for type 2 patient diabetes a get for B. And also exercise. Which kind of exercise you get for doing when you get diabetes. All those things will be on my next clip. So that's it. And remember, if you are having spikes in that blood sugar value, again, do not sit down for too long. Once in a while, get up, go around the house, and get yourself in doing something. And also stay away from insulin. Do not, for any reason, take insulin on your own. Make sure you see an endocrinologist or an expert in that field to get an advice before you go there, and take it short term, not long term use. If you have any trouble, you have my contact. Call me whenever you want, and I will guide you again on what to do. Once more, thank you for listening to my clip. My name na Dr. WAN, na una pikin, na una moyo. Share this news, share this my message for every family member. Family meeting, take them for day. Tell your brother, tell your cousin, tell your neighbor them. Say, Dr. WAN don't talk, say, insulin. That medicine where they chook them under your belly, say you get diabetes type 2, not been a fine thing. May them not take them again. That's the message for you. Once more, I love you all and have a wonderful evening. Thank you.